Hi, I'm Dr. Zadeh. I'm making this video to show you what are the steps we're taking to make dentistry safe for you again. To begin with, we have designated our office as a controlled environment dental office. The logo and the phrase we created here in the office for our office. So what does it mean when we say controlled environment? Let me show you the steps we've taken to make that controlled environment. To begin with, when you enter the reception area, the air in the reception area is being filtered by ultraviolet cleaner. In the reception area, we're going to have only one person at a time, no more those, overcrowded reception area. We ask that patients wait in the lobby and then call us before they come up so that we can make sure the other patient has already left the office. Then we've also made some changes so that people can't get too close to the office staff. And all the administrative staff in the office, they do wear masks at all times. And for ourselves, we try not to get too close to each other. For instance, in our break room is very small, and we do take the mask off. So we have this that we don't go more than one person in the break room. The most important thing I think I've done is to installation of these MERV 14 filters. There are two registers in each treatment room. One is for the building system, and this makes sure that if someone floor above, below, or next door is coughing their gut into the system, that contaminated air does not find its way in our space. MERV 14 is higher than the hospital's operating theater room standard, and it does not allow these particulates to pass through. The other one is a 5-ton extra system that I have, which circulates the air within the office. So if we get 4 or 5 people in the office and it gets a little bit busier, we can turn that system on and keep circulating the air and filter it as we circulate it. We are also being very responsible for the building and others, and what I've done is I have installed return air filters, and these special return air filters will make sure that if we make a whole bunch of aerosol in this space, they're not going to get into the building system and involve other people. In addition to that, in the room, we always used alcohol wipes to wipe everything between patients, but now we're going to do that much more thoroughly, and we are using the recommended wipes for the operating room, and we continuously are using the hand sanitizer. Then in addition to that, we have ozone generators and ultraviolet C lights, which are very powerful disinfectants, so that we can use them in between patients. Those items will be installed on Monday, the ozone and the ultraviolet. Everything else is already going. Now, the most important thing for you to consider is that the person who is working on you is healthy, so that you don't have to worry about getting anything from us. Now, personally, I got tested last week and I was negative. I didn't have any doubt that I'm negative, but I just wanted to have that documented and be 100% sure that if I'm working on patients, I don't have anything to give to them in terms of infection. I've asked my team members also, Carl and Yossi, to get tested, and for sure they're going to be negative if they're going to be working here. And if they are positive, they can, go through whatever the doctors recommend, and when they are negative, then they can come back. For sure, whoever is going to be working on you closely will have been tested and will be negative. Now, in case one of you is not sure that you're negative and you are worried about giving anything to us, let us know, because I've thought about that scenario also. I have acquired these positive air pressure hoods for myself and for my assistant. There are two of them. And if you're doing something that creates a lot of aerosol, or you have slightest doubt that you may be infected, let us know. We can work with those hoods, and those hoods will bring the air from a distant room, and that air is clean, is HEPA filtered, and this way we'll be 100% sure that we are breathing healthy air, and we can get very close to you through these hoods. Actually, we can get close to you through these hoods and not worry about anything. So I assure you, your dentistry is completely safe. In this office, I've done everything. I don't think any other office has done as much as I have done. I also did a whole bunch of experiments regarding different types of masks and what it takes for the mask to get contaminated, how to clean the mask. There are a bunch of videos on that on YouTube of the experiments I did last week. But the result is that we know what we're doing here is effective, and I have shown that through fluorescent light and fluorescent dye tracings, that what it takes, for instance, for the mask not to be effective, and when to change it, what type of mask to use. So these are all experimented and proven that we are doing the right thing here for you. And that's it. I look forward to seeing you soon. Take care.